Tonight's show, the VA healthcare crisis.
Live from the Room of Mirrors studio, you're listening to Foster Brothers on Point. Turn your selector switch to the fire position. The show is now live. I'm Hayes Foster. My brother Stephen Foster is here with me in studio. We're the Foster Brothers. We're your hosts for the evening. As Stephen just mentioned, we're going to cover some of the VA Veteran Affairs, if you don't know what VA means. The scandal that's going on that has, as some reports show, they can prove that 23 deaths are directly linked to the fact of just blatant neglect in the Veteran Affairs healthcare system. And any veterans out there listening probably may actually have an idea what we're talking about, how if you show up sometimes they may blow you off and say, well, we're going to schedule a procedure for you, no follow-up calls. Things like that are what's leading to veterans losing their lives. Stephen?
That's right, Hayes. The whole Veteran Affairs hospital system is, for the military and the returning vets that come back. Anyone that's served for the military and the military has access to this right. It's part of what you get for serving your nation. It's long been complained about, and the people that have used it have generally tried not to use it if they could financially afford it. Now, a lot of the libtards have actually used the VA model and said that it's a great system and this is what Obamacare is modeled after. And they actually were praising and touting the VA system, healthcare system, as a reason to pass Obamacare.
And, at this point, Obamacare is just getting ramped up. There's still a possibility they're not even going to get enough people to keep this thing afloat. They'll probably, even if they don't get enough enrollees in Obamacare, they'll definitely just keep funding it because, just to save face. And, well, they print money anyway, so who cares, right? So, like Stephen said, it was the VA healthcare system was the model. And if you remember, there was a lot of talk about death panels, basically panels of people that would decide whether, maybe you were too old to be useful anymore, and they might deny you a treatment or a surgery or a procedure that could potentially extend your life. That's what the VA healthcare system is. That's what the Obamacare system is. This is rationing. This is insurance companies being able to get out of paying for procedures. That's what this is all about, saving money for the big boys.
Now, what we have is, with the VA system, is we have a government-run healthcare system that, has a long track record of failing. Anyone that's worked in the government know that the government, and any government job, whether small or at the Fed level, doesn't exactly operate efficiently. What it does is it operates and it loses money. You would never put a contract or a bid for contract out and just accept your buddy who bid a couple $1 million over, sometimes $1 billion over. Private industry doesn't do that. They try to run lean. There's several lean business models out there where the government runs on the FAT system, where they just try to hook up their friends, and anyone in the administrative system that can, get a favor in, they'll do it. And that's why you have a failure. You have a failure because everyone's trying to abuse the system. They're taking it for a ride. It's not run like a normal business.
And we're talking about abuse on a lot of different levels. Not only has there been documented just lack of follow-up with people, veterans with legitimate health issues. I've got something here from the Weekly Standard, and it's showing. They asked Obama at a press conference, and I'll just read this quick excerpt for you. Um, Here's a question. Mr. President, as you said, is this a cause of your presidency? You ran on this issue. You mentioned, why was it allowed to get to this stage where you actually had potentially 40 veterans who died while waiting for treatment? That's an extreme circumstance. Why could it get to that point? And Obama responds, well, we have to find out first of all exactly what happened. Pass the buck. I don't want to get ahead of the IG report or other investigations that are being done. So during his campaign, he actually ran on, he mentioned several times while he was campaigning that he was going to fix the VA system. It looks like he hasn't done anything to the VA system to make it more efficient. People are losing their lives, potentially 40 according to the Weekly Standard, and that's probably the tip of the iceberg on this.
Well, when the government steps in and they want to control your life, but the way they're controlling it actually is causing deaths, you have to be concerned. A lot of times, we get upset when law enforcement oversteps their bound and uses excessive force. Rodney King or any of the hundreds of examples currently out on YouTube right now where people are getting beat up just because they didn't stop at a stop sign correctly. Now, basically what we have is a system that's failing. They used it as the model for Obamacare, and they have evidence, and people are dying. Now, this is kind of where the death panel thing comes in. It may not be official death panel where you're sitting in front of a judge and someone's like, oh, you get the treatment, you don't. But what we have is we do have secret lists that are coming out that are emerging, that somewhere in the administration, they're making decisions on who's going to get that treatment, not. And this might be based on your income levels. This might be based on your family. It might be based on, how many people you currently have in your family serving. We don't know.
Or it could be possibly based on your political affiliations. Maybe who you've contributed to. Maybe you contributed to a Tea Party.
Well, that's what you have to take in consideration is we have a setup or a scenario where people can actually make a decision on if you're going to get that treatment, which will save your life, or if you don't have it, you'll die. And this is a realistic example of what a death panel looks like in operation. So when all those protests were occurring a couple of years ago, and they were saying, we don't want the death panels, well, here you go. We've got them. Looks
like we've had them, actually. This veteran, this VA scandal that's coming out is, I think it's the tip of the iceberg. Sadly, Obamacare was modeled after the VA healthcare system, and that's really not encouraging. Looking at what's coming out right now, just one more example. A gentleman named Donald Douglas went in 2011 to the Seattle Veteran Affairs Hospital. They confirmed through a biopsy that it was cancerous, and he wasn't scheduled an appointment to have it removed for 4 months. By then, it had already spread, wrapping around a facial nerve and eventually getting into his blood. And he died directly because they didn't stay on top of it. They did not, get him in there quickly. Say, hey, it's just a small spot right now. Let's get after this. Let's get this, cut out. And that's one, and that's a pending lawsuit right there from the family.
Now, here's what we know about cancer: is at this day and age, if you live in America, you've known someone that's had it, or someone in your family, close friends, family's had it. You've been around this and you've discussed it because it's so rampant. This is a huge disease plaguing our population. Now, what we do know is if you have normal insurance through a normal carrier, for example, in Tennessee, one of the big carriers is Blue Cross Blue Shield. If you go in because you're dizzy and you get diagnosed, they're likely going to find time to either do treatment or surgery right away. So if you get diagnosed on say Friday, well, you're probably going to be in surgery at least by Monday. Now, that's a normal plan on most people's insurances that's not a government-funded insurance plan. So what we've got is a scenario where if you're on the government insurance plan, well, we're just going to push it back 4 months and see what happens. They know good and well that it's probably going to spread to the point to where there'll be no recovery.
And that's a shame, because when you think about what veterans have sacrificed for this country, and I'm not talking about whether the war was justifiable or not, because we know some of them are clearly wars for profit, natural resources. It's, I mean, the general public isn't as naive as the social engineers would have you believe. So, maybe on some of these veterans' Facebook pages, they post some of their political thoughts, or maybe candidates they don't like or they do support. And those things can definitely be taken into consideration of whether your procedure gets approved or not. And that's the reality of it.
It's just like the whole IRS scandal where they were targeting Tea Party members. There's a track record. We're not just saying this because we're anti-communist. We're saying it because we're anti-democrat, communist, libtards who, by the way, Democrats are not really liberals by definition. They've actually self-coined themselves that. Real liberals are for freedom and individuality. So Democrats trying to label themselves as liberal is kind of a misstatement anyways.
The pattern that has emerged is, if you don't go along with the latest government scam that they've come out with, such as Obamacare, it looks like they're scamming veterans after these veterans have put their life on the lines for this country. If you don't bow down and worship .gov and just be fascinated with, the government, they're, it's so fascinating, or you don't, try to get you some kind of government job where you think you're going to ride off in the sunset with a pension. They don't care about you. And that's the thing about it. A lot of people don't understand that, a governed people is only governed by their consent only. And when that governed group of people perceives that the government doesn't give a rat's, they don't care about what's going on in the people's lives, they don't care about individual liberties, when they feel like their rights are being trampled on and they're being ignored, that group of governed people can abolish that government. And that's out of the Constitution.
Now, Hayes, you haven't even touched on something that I'm kind of finding significant with this whole VA scandal. Is you have men and women that have served this nation. They've put their life on the line. They've rode in the Humvees into war zones, running the 50 cal machine guns, blazing into a war zone, taking out their enemies.
Lost limbs, some of them.
And they get hit by IEDs or RGBs, whatever they're getting hit with. They're getting injured. They're getting shot. They're getting small arms fire. And they come back to their nation, and they get put on a list. And, well, in the meantime, they have gangrene, and their leg rots off. And then now they're an amputee, and now they have to live their life with a lost limb. Meanwhile, we've got another fella that lives in Mexico City that comes across, and, he comes and swims the Rio Grande. And, we know they're all hard workers, but it's not legal. And they come across, and they reproduce, and they have babies, and they stroll right into the hospital.
Anchor babies.
And now these are the better hospitals. They'll stroll straight into a normal St. Thomas or Baptist hospital and deliver that baby, and there's no charge. It's all covered. Where you have a veteran that's put their life on the line where they have to go into the VA hospital, and they're on a waiting list. We have now documented evidence. That's what we're talking about. It's finally official. This is not hypothetical anymore, and we're kind of mad about it. That's what's happening.
Well, as Stephen mentioned, it is sad to see a lot of care provided to people who aren't citizens. I swim to Rio Grande. Well, guess what? That's great. But that does not give you citizenship. You can come in and abuse our healthcare system. You can come in and get, on government assistance programs to get housing stipends, Section 8, whatever we know that's going on. It's been going on for a long time. It's not talked about a lot, but most people know that that's what happens when illegal fruit pickers swim to Rio Grande. So, here we are, and we're giving these people who aren't citizens great health care. We're giving them money for housing. A lot of just a lot of things that the veterans are being denied, and the veterans are citizens and they have served in the military. We're at a real interesting point in this country. Let's just say that. Let's go to our sponsor. Foster Brothers on Point would like to thank MyOneSupply.com for sponsoring the show. MyOneSupply.com, suppliers of fine tactical and firearm equipment. MyOneSupply.com carries top shelf brands such as EOTech, Trigicon, Eberly Stock, and more. MyOneSupply.com carries genuine military surplus items and survival gear. From the battlefield to your front door, check out MyOneSupply.com.
Well, Hayes, I don't even know if you've seen this in the news today, but they're talking about Obama's giving a multi-billion-dollar bailout to the insurance companies. I don't even know if you've seen that today, because that was just kind of one of a side headlines today where this is just a little bailout. I mean, I guess when you're not giving trillions, but you're just giving billions, you don't have to, it doesn't need to make big news. I mean, it can be a side article. Let's just give, I think the number was like 88 billion or something.
And the reason that it won't be a front page story on any of the controlled media, whether websites or print media, is because they're think tanks such as Rand Corporation and others. They have done surveys, and they found out that people do not like the term bailout anymore because it implies that they're getting free money, which they are. We know how the bank bailouts under Bushy Boy, in late 2008. A lot of people didn't support that. They got pushed through to keep the zombie banks afloat. So the scam was up. Instead of letting the cards fall as they should have, they just kept perpetuating that scam, and it looks like another bailout has occurred, Tubbs.
Well, if you start a small business like one of our sponsors, My One Supply, let's say that our listeners didn't go to their website and didn't make a purchase, and they eventually had to go out of business. Well, guess what? There's no bailout for that.
And there's no bailout for Foster Brothers on Point either. We do this because we care about the country, and we feel like there's a lot of topics that aren't getting covered. That's why we're here. That's why there's a microphone in front of our face.
We think that we're at the point to where all the protests, all the rallies, all the bullhorn, and all the YouTube videos we've made for the past 10 years, they're not making a change. We call our state representatives. We're calling people up in Congress. We're trying to get things changed, but it hasn't been effective, apparently, mainly because they're ignoring us. So we've taken to the radio.
That's right. I've got another. And earlier when we were talking about, people being denied treatments and procedures and potentially losing their lives over it, we had a whistleblower come out of Miami. His name is Thomas Fiore, Fiore, and he's come out and said that, and actually what he does is he's a veteran affairs police in police department in South Florida, and he contacted the CBS 4 News, and he's saying that one of the charges that he says is there's drug dealing on hospital grounds on a daily occurrence. And this is a quote from him: "Anything from your standard prescription drugs like Oxycontin, Vicodin, Percocet, and of course marijuana, cocaine, heroin, I've come across them all." So here's a VA cop who's busting just out in the open blatant drug dealing on the VA hospital property. That's how far down, that's madness. People are there to get help and treatment, and apparently it's just a big drug swap, some of it. You've also got he said that there's he thinks that because they won't crack down on the drug dealing, there's someone who died. His name was Nicholas Cutter, a 27-year-old Iraqi war veteran with PTSD who died from a cocaine overdose inside the VA's drug rehab center. How about that?
I think the key thing here is to realize that the drug dealers, what they're saying in this article, it was staff. You got VA staff doing the drug dealing.
So that's the level of corruption that we're looking at here. So it's top to bottom. Apparently, it's a free for all. And let's see, what else do we have here? Oh, also this officer Fiore, he's been complaining because a lot of the surveillance cameras haven't been working for 4+ years, as long as he's been there. And it looks like he's claiming that VA hospital in Miami received somewhere between 2.5 to 3.5 million, and he doesn't know where the money's gone to because, and this is a quote from him, "I can tell you it wasn't spent on cameras or any other recommendations that were made in the assessment," he said, because they've still yet to be corrected.
Well, also, there's multiple things going on. They're talking about the theft. Now, what they're saying about the theft, and that's partially to do with the cameras, Hayes, is that people are walking off with equipment they think they can resell. So if you're ever on eBay and you're seeing medical equipment for sale, you might just be purchasing it from a VA employee that's unsatisfied with their $20 an hour, and they think they should be getting more because they're a government employee and they want the world. Well, they just decided to walk off with some equipment. This is the problem with government. A lot of our listeners are well aware that I used to work for the city of Franklin in Tennessee, and I can't tell you, there were several times where I caught some of my employees or other staff members walking off with stuff. And it wasn't, cheap items. If they thought that it was worth something, they were walking off with it. It's sad, but it's just rampant throughout government, top to bottom.
That's real sad because, obviously the veterans deserve a lot better than this. They themselves have put their life on the lines. Their families have been without, a husband or a mother or their kid being overseas. And, they get back to the States and this is what they're dealing with. They're dealing with corruption. They're dealing with not being able to receive treatment and procedures in a timely manner. Drug dealing at the VA hospitals themselves. It just makes you want to spit on the ground. That's what it's sad.
Well, this is what you need to get used to. Like, this is kind of a canary in the coal mine when it comes down to, your Obamacare healthcare. If you're one of the few people that have signed up, which is a very small number at this point, just get ready because this is what you signed up for. Now, I recommend no one signing up for it because it's a fraud to begin with. It's potentially a data mining collection opportunity as well. I would stay away from Obamacare at all costs.
I agree with that. It's fraudulent activity. It was barely passed because they had to pay off a few congressmen and senators with some deals, some backroom deals that a lot of those details aren't even released to the public because there'd probably be an armed rebellion.
That's right, and I think that a lot of people are just getting fed up with the government doing what they're doing. Like the news today that they're going to give the insurance companies $88 billion. Now, where are they getting why do they need that? What's the bailout for? Well, since when have you ever met a insurance company owner? I've only known one, and it was like a friend of a friend, and they had a fleet of helicopters just to fly their family around. So I've never known any insurance agent, or not agent, but insurance company owner to be really hurting. So we've just bailed them out. So let's just be glad that we've given them some more money. I have to assume, though, that it was really a bribe, because that's probably what it was.
And let that sink in. They've done the banker bailout. Now they've done a insurance bailout. But mysteriously, that's not the top story, is it? When you cut on the evening news. Well, the reason they're not going to talk about it is because the think tanks have shown that bailouts are extremely unpopular because a bailout is basically saying we don't care about the working class or the middle class. We care about the elite, and we're going to take care of our own, the elite.
Yeah, we've all been through the bailout things, and if anyone that keeps up with the news or is halfway conscious about our world, the bailouts in 1998 and all through current have been fraud. They've only benefited the few elite, and they've only really propped up these big companies, which probably didn't need to be propped up to begin with. They're just bribe. You know, how do you get a company like GM, or how do you get a company like Blue Cross, Blue Shield to go along with your fraudulent activity? Well, you got to pay them off.
Yeah, or they're so worried that the effect of one of these companies going under, would affect so many people that they probably threaten congressmen and backroom deals and say, hey, think about the effect of this. Think about if this many million people are going to be automatically without insurance. What are they going to do? It's scare tactics. That's what we're dealing with. We're still dealing with the fear-based reality. They keep pushing the fear. Oh, if we don't, we got to give them some free money, or things could get nasty.
What we have to realize is our nation's been taken over. We're no longer the United States of America. That's a fake company name that they call it. We're owned by British Empire, basically.
We're owned by bankers, a lot of it, and insurance companies.
Have you guys noticed recently how the past few presidents have been Bush or Clinton? I mean, they're talking about a Hillary Clinton run.
Oh, for 2016. Oh, that'd be great. Another Clinton.
And they do all these, now that DNA is a popular topic, they're like, yeah, it's ironic that Bushy boy and the Clintons happen to be related to the Crown of England. That's funny.
Just pure coincidence, Stephen. I'm sure there's that's just randomness.
So we might get Hillary in 2016, and if she can even survive that, because what is she in her 70s now?
Or last I heard, she was brain damaged.
That's what I've been hearing too, and that was why she disappeared off the face of the earth for a few months. But then they're talking about Jeb Bush. I mean, Jeb Bush can hardly even speak.
Well, and Hillary with the brain damage. I mean, that explains Benghazi. What is it she said? Hold on, there's a famous, what does it matter? Like she was just washing her hands, like she doesn't care about the lives lost in Benghazi. I mean, she's an absolute fraud, just like her whoremongering husband, Bill.
She might actually be crazy. I actually would hate to see her get in office. She might do some crazy stuff.
She seems like a fruit bat. I really hope she doesn't get in. We're already in trouble with Obama. Fruit bat Hillary will it's going to be over the top.
Yeah, I mean, it would be absolutely horrible to see her in there. But what we have is a fraudulent government. That's number one. Number two, it's been in place for years, and it's getting worse and worse, which tells us that they're moving towards something. And I think that's kind of where the New World Order comes into play. We're talking about a scenario to where there's just a couple of families running the entire world, because, what's wrong with this world? Greed and power. And when you have both and you've actually succeeded at it, you keep expanding it, you pass it down in your family lineage, there's nothing wrong with working hard and owning a business. But when you actually enslave people, then we're talking about some trouble, because that was not why God created man.
Or get preferential treatment by buying off congressmen and senators. That's a big problem, too, in this country.
Well, the fraudulent dictatorship, Obama, and I don't even know how he made it in, because you got the Bush family and you got the Clinton lineage to the England crown, and then you throw in Obama. I mean, you just have to wonder how he even made it.
It's another ripoff, another scam. We appreciate you guys tuning in to us tonight. We'll talk to you guys next Thursday evening, and I'd like to give a shout out to all the skateboarders out there. Keep ripping. And Foster Brothers on point, signing out.
Last night I heard this politician talking about his brand new mission. Liked his plans, but they came undone when he got around to God and guns. I don't know how he grew up, but it sure wasn't down at the hunting club. 'cause if it was, he'd understand just a little bit more about the working man.